how many grafts am I going to need to achieve the results for my hair transplant? Now this depends on several factors. The first factor is the severity of your existing hair loss. If, for example, you've lost a large density of hair or a large surface area of hair, obviously your graft count is going to go up. Secondly, it depends upon how dense is your donor area. Can we actually extract the number of donor hairs that we require to achieve the necessary results? The third factor is what density are we trying to achieve. If, for example, we're treating the frontal hairline and it's quite weak, there's a certain amount of recession, the density count will go up. Why? This is the area which everybody is going to see. It's the area that you see when you come out of the shower or you're swimming and you can see through your hair. So for this area, the grafts need to be placed very, very closely together. The closer the grafts are together, the density count is going to go up. Why? We're going to require more of them. As we taper backwards, we can achieve a lower density count because the front is covered by the hairline. Now, finally, some patients, what they require is a small surface area. They want more coverage. They may not be after the density of the frontal hairline because of a reduced number of donor grafts in the back. For these patients, we will obviously provide a larger surface area of coverage, but the density will be lower. During these transplants, you can achieve a good result with a moderate number of grafts. So it's very, very important to realize that the final result is a combination of technique, skill, the incision angle at which you place the grafts, the incision at which we cut the scalp for the new graft to go into, and finally, how close we place the grafts together and over what surface area. To simplify it, the larger the surface area, with a fixed amount of grafts, the density will go down. The smaller the surface area which you require and the density count is fixed, the density count will go up. So I hope this really helps. As you all know, everyone is an individual. No two patients are the same, so it's very important to come in for a consult. We're going to assess your scalp, the type of skin you have, the type of donor hair you have. Is it curly? Is it straight? Is it actually even amenable for a transplant? All these factors taken together is what we consider during the surgical planning. And the planning is so important because that's what allows us to achieve a very successful surgery with very favorable outcomes. Hope that helps. And if you have any other questions, please feel free to leave us a comment below and we'll try and get to it very soon. Thanks very much.